Hi, Hillary. What is it that brings you to the office today?
I have gained 20 pounds since graduating nursing school, going through nursing school, and I would like to try to lose that.
Okay. What I'm going to do is take a health history from you, and we're going to just start out with some basic information. Could you give me your full name
Hillary Schulte,
and your address?
13513 Route B, St. Thomas, Missouri, 65076.
Okay. And what's your phone number?
And my home phone is 573-477-0116.
Okay. All right. And your age?
24,
And what's your date of birth?
6/27/1989,
All righty. And where were you born?
Jefferson City, Missouri.
Okay. So you lived here your whole life then?
Yes, I have.
Oh, great. And you're female, of course. Are you married?
I am single.
Okay.
Yes.
And you're Caucasian?
Mm-hmm.
Okay. And what's your religion do you practice, if any?
Catholic.
Okay. And can you tell me where you work currently?
I am an RN at Capital Region,
Okay.
and then I also work at Jefferson City Correctional Center.
Okay. And do you have insurance through your job?
Yes, I do. I have all medical, dental, and eye.
Okay, wonderful. That's a great benefit.
Yep.
All right. So you said you were coming in today to discuss some wanting to lose weight. What sort of health beliefs and practices do you have regarding your everyday health and patterns that you use for your own health?
I try to walk frequently, try to take care of myself. I don't eat quite like I should, I'm sure. I don't eat, drink a whole lot of milk or eat a lot of calcium.
Okay.
And fruits and vegetables, maybe more of those, definitely.
Okay.
But otherwise, I go to the doctor regularly, have regular exams and everything like that. Eat the home cooked meals. I don't need to have a whole lot.
Well, that's helpful. You like cooking then?
Sorry?
Do you like cooking then?
Yeah, I don't enjoy cooking a whole lot, but we do cook.
Okay. And so for medications, do you take any medications right now?
No, I do not.
Okay. And you mentioned some goals earlier to lose about 20 pounds or so. Is that correct?
Yes, it is.
Okay. Any other
20
concerns?
pounds.
Okay. Any other concerns right now or goals that you would like to try and reach?
No, I think that's just pretty well it.
Okay. Gonna ask some questions about your past health history. Did you have any illnesses as a child?
Just the chicken pox. I don't remember how old I was, but I did have chicken pox growing up.
Okay, those are no fun at all.
No, nope.
Okay, and what about your immunizations?
I am up to date on my immunizations. My last tetanus shot was back in March.
Okay.
I take an annual flu vaccine. Otherwise, with my job, everything has to be up to date.
Okay, yeah, that's a great thing about being a nurse is you have no choice in keeping things up to date. So even if you don't want to get them, you do anyway. So, well, that's
Exactly.
great. That's good. Have you had any illnesses or hospitalizations or surgeries in the past?
No, the only thing with the medical, I just have a yearly flu. That's it, just seasonal allergies maybe.
Okay.
But otherwise, no surgeries, no blood transfusions, no hospitalization or anything.
Okay, no surgeries then.
No, for injury, the only thing that I really had with that is whenever I was younger, I had 18 stitches in my foot because I cut my foot.
Okay.
And then in my lip, I had 4 stitches. I got
wow.
them out and got 4 stitches there.
Okay. All right. What about your emotional state? Do you have any anxiety or depression problems?
No, none of that.
Okay. And you did mention seasonal allergies. Are there any other allergies like to medications or foods that you know of?
No, I'm allergic to wasps. I don't have, any medication for that, but I am allergic to wasp stings if I ever get stung, and just no serious reaction with it.
Okay.
No life-threatening, I guess.
Okay.
Otherwise, not allergic to any foods or any medications or anything.
Okay. What about tobacco, alcohol, or any drug use?
No tobacco or drug use, just the occasional, alcohol use with friends and family. That's it.
Okay. And this is going to be some questions about your family history. What about your father?
My dad died whenever he was 46 years old. That was last year. And it was liver cirrhosis and COPD, and it was alcohol related.
Oh, that must have been difficult.
Yep, it was.
Okay. And what about your mom?
She has hypertension, and she's pre-diabetic, and in fact, it's monitored pretty regularly.
Good.
And she manages it with diet and exercise.
Oh, wonderful. That's great. She doesn't have to do any medication or insulin or anything. What about your siblings? Do you have any brothers or sisters?
I have 3 sisters. One's 27, and I have another one that's 26, and one that's 20.
Okay.
They don't have any known medical conditions or anything.
Okay. And what about your grandparents?
My grandpa died whenever he was 66, and that was from COPD and COPD and liver cirrhosis, same as my dad, all alcohol related and everything.
Okay.
Otherwise, all my other 3 grandparents are alive and well.
Okay, very good. Some questions about your psychosocial history. What about, you said you're an RN now. Have you had any other work previous to that?
I worked for the Jefferson City area YMCA whenever I was going through college, and I worked there part-time with the kiddos.
Okay.
And then I started in March working for Capital Region, and then just here recently I started working for Jefferson City Correctional Center after graduating from Lincoln with the associate's degree.
Okay, well, you just answered my next question, which was about your education. So you have your associate's degree, and that's from Lincoln.
Yep.
Any other schooling, or are you working on anything else?
I'm currently working on my bachelor's degree at Lincoln with nursing.
Good for you. And about, what about financial background? I guess you just pretty much entered the workforce.
Yes, I did. Growing up, we did pretty good. We got everything that we needed. Was never really struggling for anything. Now I'm able to pay all my bills and everything. I don't have any, concerns with any of that.
Good.
I do pretty good.
Good. What about your roles and relationships with family and friends? Are those pretty healthy relationships for you?
Yes, they are.
Good.
We spend a lot of time with family and friends, especially family. My mom tries to do family gatherings every 2 weeks.
Good.
So we can all get together and see each other and have a good time.
Wonderful.
My boyfriend, I've been dating for 5 years, and we're doing great with that.
Good.
Everything's going wonderful.
Excellent. It's important to have your family and friends and a boyfriend to count on with things when they get stressful, and that's great that you're all so close. What about your ethnicity and culture?
I am an American, and, I'm very proud to be that, very supportive of the American culture, but we do eat a lot of red meat and potatoes, which is probably not all that healthy, and we have a lot of family gatherings that involve a lot of food.
Right, okay. And what about, does your family all live close by, or are they?
Oh, yes. Yeah, we all live here in Jefferson City. We're all within, Jefferson City area. We're all within half an hour of each other.
Oh, good. So you can stay pretty tight-knit then.
Oh, yes.
Good, good. And what about spirituality? You said you were Catholic?
Yes, I am a practicing Catholic. We do, pray at meals, and we think highly of praying and being honest with everyone.
Okay. And what about, as far as how you feel about yourself right now, are you pretty happy with where you are right now in life?
I am, yes, I am. I don't have any, I think I have a good self-concept. I try to keep positive attitude, and feel positive about myself, because that's, important, especially with being a nurse. You need to be confident,
okay,
positive, have a good attitude.
Right, okay, good. let's talk a little bit about your physical health currently. What about your skin, hair, and nails? Are there any concerns there? Anything abnormal?
No, I have, nice pink skin, pink nails, everything's good with that. My hair, I have brown hair. I wash it every day and try to take care of myself as best as I can.
Okay. Any trouble with your head or neck, or any lumps or anything in your neck that you've noticed?
No.
Okay.
No, there's nothing like that. The one thing about it is I have an occasional headache that I take ibuprofen for, but other than that, it's nothing concerning.
Okay, alrighty. What about your eyes? Do you wear glasses or contacts?
I have glasses and contacts both, so I have to go for an eye exam, and I do keep that regular. So I have to go once every year.
Okay.
And that'll be next month is my next appointment with that.
Oh, good. Okay. And what about respiratory? You have any cough or lung problems that you know of?
No, not. I'm not a smoker or anything, so I don't have anything with respiratory. Everything's fine. No shortness of breath, no history of asthma or anything.
Okay, good. And what about your breasts? Being female, it's important for us to all have our monthly breast exams, and then if we were to find something, of course, we'd want to go see our doctor.
I go to an annual gynecologist, I guess, and we do she does the annual exam. It's a regular one for me because I'm not, FDA to have a mammogram yet.
Right.
But otherwise, I do self-breast exams every month, and everything's good.
Okay, great. And what about cardiovascular health and your veins and things like that? You have good circulation?
I do. I try to walk every day, so try to get my, blood flowing good.
Okay.
I don't have any history of any heart conditions or anything like that. My blood pressure is usually about 110/80.
Oh,
what it normally runs at. Everything that gets, I get it checked every year too. So,
good.
But other than that, everything's good.
Okay. And do you have any trouble with your abdomen, your bowels, or any urinary problems? Any history of urinary tract infections?
No, I have a regular bowel movement. No history of constipation or diarrhea or anything.
Okay.
And no UTIs. I drink, 3 to 4 liters of water a day, so I go to the bathroom quite frequently.
Okay.
And I try to only drink water, so I think that's a big thing too.
Okay, great. Yeah, that's important. Water's one of the best things you can drink, so that's great to hear that you do that. What about reproductive problems or any reproductive issues? When would you say you started your first period?
I was about 12 or 13 whenever I started my first period. I have, regular every 28 days or so.
Okay.
I don't know about, my reproductive parts because we haven't tried to have any kids yet, so that'll be a concern here in the next few years.
Okay.
Hopefully not, but
okay.
My family seems to do pretty well in that.
Okay, good. Any muscle or bone problems?
No, I don't have. I've never broken any bones. No muscular problems or anything that I know of. No muscle pain or anything. I do try to exercise every day.
Okay.
So that way it keeps my muscles strong.
Yeah, it helps your bones too. Keeps calcium in your bones. What about any neurologic problems? Any trouble with seizures or anything like that?
No, I don't have anything with that. I just, like I said earlier, just occasional headaches. But other than that, no, I don't have any seizures or anything like that.
Okay. Well, it sounds like maybe on the next visit we could talk some more about maybe you were saying you wanted to perhaps lose some weight. We could maybe talk about some weight loss for you and maybe some ways that we can look to improve on your diet as far as vegetables and calcium and things like that.
Okay.
Okay.
Good.
Do you have any other questions or concerns today?
No, I think we've pretty well covered everything.
Alrighty. Well, thank you very much for coming in.
Well, thank you.
Alrighty.
Have a good day.
You too.